Okay, this is a question about what you think about the cord insertion into the placenta.
Okay, so this is an issue that comes up. Of course, we always check to see the cord insertion into the fetus. And now I think that the latest guideline actually asks you to check cord insertion into the placenta.
Okay.
And the reason is because of Velamentous cord insertion, which is a very important entity. And whether it has significance in terms of obstetrical complications of growth and premature delivery and things like that, I think is relatively less important to us as sonographers as its importance in terms of possible vasoprevia.
Mm-hmm.
There are times when you absolutely must check for a vasoprevia. Things that you thought were placenta previa that seem to have disappeared.
Mm-hmm.
Anytime you think you see a vessel near the placenta, near the internal os, any case of succenturiate lobe,
Mm-hmm.
and any case of vasoprevia. I'm sorry, not vasoprevia, a Velamentous cord insertion. Those are the times when you must do a color Doppler over the cervix. And by the way, it's not a bad idea to do a color Doppler over the cervix case after case.
I have the sonographer do that on every case.
I think that's an excellent idea. So do I. Okay, this is a pretty typical Velamentous insertion. You see the end of the placenta here, and the cord is inserting into the membranes at that point. Now, you can see that the flow is clearly in these vessels, which will then ramify over the placenta. The good news is we're nowhere near the cervix, but that wouldn't dissuade me for a moment from checking over the cervix for a vessel, and I would do that endovaginally because it's the best way to get a look for that.
So even if this is completely away from the cervix, just in case you might...
Yes, the bottom line is vessels wander.
Mm-hmm.
Once they're off the placental surface, they wander.
Okay.
And you want to be as convinced as you can possibly be that it didn't wander over the cervix.
Okay.
There was a cine clip that I thought was helpful. Yes, and here you can see very nicely how this is a Velamentous insertion of the cord, which will then subsequently ramify over the placenta. Now, one of the things that color can help you with is if you're not so certain that what you're looking at is the cord insertion on the surface of the placenta, color can help you to see vessels ramifying away from it.
Sure.
Even if it's hard to see that that's the actual insertion point.
Mm-hmm.
If there are vessels ramifying in two different directions, almost certainly you have found the placental insertion site of the cord.
Good point. So do you think, in your experience, should these people be followed up for growth issues?
Yes.
They should. Okay. What about a peripheral cord insertion within,
Yes. Basically, these issues are more important in monochorionic twins than they are in singletons.
Sure.
But the obstetrician will make the determinations about follow-up for growth. But you can pretty well rest assured you'll be seeing the patient on more than one occasion if you identify this abnormality.
And also a peripheral cord, not a Velamentous, but peripheral. Just say it's inserting way out here on the edge of the placenta.
Yes, again, I think you will find that the obstetricians will tend to follow those patients more closely. I can't honestly tell you that I think that these obstetrical issues like growth and premature delivery have been big players in my experience. The big player and the really dangerous one is vasoprevia. Miss a vasoprevia and a disaster is going to happen.
Good to know.